I'm sitting here with Dr. Trimble with Dallas Breathe 3. I'm meteorologist Dan Brounoff here in the Dallas-Fort Worth area. And of course, you helped me out a year ago, actually twice and a few years before that. So I'm sitting at home and I've been miserable all year. We're getting into fall now and eventually spring's going to be here. What are some of the, symptoms of chronic sinusitis? And a lot of people may not even know they have this. What should they be looking out for to say, hey, I need to call Dr. Trimble at Dallas Breathe 3?
Well, I think that's the issue is with chronic sinusitis, it's more of having something that is never good, as opposed to maybe an acute illness like you see with acute sinusitis. The most common symptoms of chronic sinusitis are, nasal obstruction and nasal congestion. You also, have facial pain and pressure. You have maybe decreased sense of smell or thick postnasal drainage. But what I tell people, instead of trying to think of those specific things, is thinking, how is someone's life impacted if they're not breathing well through their nose? And one thing I remind patients all the time is that the most sensitive time that affects you, and when it's always going to be worse, is when you're actually laying down sleeping at night. You get blood flow redistribution towards the nose. And so even though you may be fairly symptom-free during the day, you may be noticing that, maybe you're snoring at night. Perhaps you're just waking up not feeling as well rested as you used to be. A lot of times when people begin to feel more fatigued, or maybe their quality of sleep is off, a lot of times they think maybe it's their hormone levels or there's something else going on in their life. Maybe they have young children that are waking them up a lot. But what you find is that when you're having to work harder to breathe at night, you wake up not feeling your best. And certainly as that progresses, you can wake up, with headaches, maybe ear pain or pressure or other symptoms. I always remind people that sleep should be restful and restorative. If it's not restful and restorative, then you just continue to build up more muscle tension in your head and your neck area. A lot of times people just complain of not feeling well. You definitely see an element of maybe being down, maybe being depressed, maybe not, just feeling as energetic as you used to. We also get a lot of patients maybe who are having issues with, maybe they kind of feel off balance, or maybe they were recently ill and they've had issues with vertigo. A lot of these problems that people have are truly stress related, but I remind people there's nothing, more stressful for a normal person than having to work to sleep at night because they're having to work harder to breathe than they used to. And so I think a lot of times as patients don't appreciate that maybe their immediate problem that maybe hasn't been going on that long is related to a chronic problem that perhaps has been going on for years. They just haven't really thought about it. And so a lot of times during conversations in the office, talking to patients, sometimes after a while they begin to realize that, oh my goodness, I really don't smell things as well as other people, or maybe I really am more tired than I thought that I was. Maybe, the headaches that have been more prevalent are related to these issues. What's interesting is that if you see patients after treatment, after intervention, whether it's in the operating room or in the office, like what we do, is often there's symptoms that improve that they didn't even really realize that they had. And so I think that, a lot of times patients, they think that how they feel is their norm for whatever part of life.
They've been going through it
exactly.
So long, right?
And at some point, and that's why that, you can put up with things in your life for long periods of time. I mean, I'm a guy, so I'm very good at that. It's very different than if all of a sudden, you have an acute appendicitis, maybe you break an arm, you've got a bad knee. I mean, you've got to do something about those things. You can't ignore them like you can ignore your nose.
Right.
But when it comes to quality of life, having chronic, sinusitis can affect your quality of life negatively over time as much as almost anything else that's going on in your life. And so I think that's why we see so many patients with diverse issues, that ultimately so much of that tends to come down to what's going on in their nose and their sinuses.
Right. Good stuff.